Commissioner Kit McFarland. I'm Charles Whiting. Also in attendance, we have our township manager, Pat Stasio. We also have our assistant manager, John Bates. We have our solicitor, Brianna, Bryant, all in attendance tonight. But before we begin, we have a special announcement by our Pat Stasio, our township manager.
Thank you, Commissioner. Just an announcement. There's been a slight bug infestation possibly at the Upper Moreland Free Public Library. Just announcing tonight that the library will be closed through Thursday when different exterminators and other animals that can come in and sense which type of insect might be there. We do not know if it is indeed a fact or not, but out of an abundance of caution, we're going to close the library through Thursday. After that point, we'll make some more announcements.
Thank you. I ask for the approval of the minutes for the July meeting to be approved. July 15th meeting to be approved.
I have no questions.
Yep, it was good.
Okay, we will proceed then. Now we will have our monthly reports, starting with our police chief, acting police chief, Rudlin.
Good evening. Thank you, sir. The monthly report for the police department for August. The police department responded to 1,288 calls for service in the month of August 2024. The total calls for service year-to-date is 10,453. The calls for service between July 2024 and August 2024 indicated a 6.7% decrease in volume. The monthly police department call volume decreased by 0.11% between August 2023 and August 2024. The overall difference between year-to-date August 2021 and August 2024 call volume is 11.56% increase. The following Part 1 crimes were reported and investigated by Upper Moreland Police in August of 2024. 1 aggravated assault with 1 clearance by arrest, 34 theft offenses with 16 clearances, and 1 auto theft. The following Part 2 crimes were reported and investigated by the Upper Moreland Police in August of 2024. 1 public intoxication, cleared by arrest, 1 disorderly conduct offense cleared by arrest, 5 narcotics offenses cleared by arrest, and 31 other crimes committed cleared by arrest. The patrol division conducted the following proactive measures: 354 vehicle investigations, 41 hazardous traffic violations, 137 non-hazardous traffic violations, 27 parking citations, 11 homeless contacts, 15 DUI investigations. 3 of those were between the hours of 7 a.m. and 7 p.m. The Traffic and Highway Safety Unit conducted the following investigations, activities, and studies during the month of August 2024. 69 calls for service, 9 traffic and parking issues, 1 citizen concern, 1 traffic study, 2 directed patrols, 120 traffic stops, 76 warnings were issued, 25 hazardous traffic citations were issued, 54 non-hazardous traffic citations were issued, 3 abandoned vehicle investigations, and 5 motor carrier enforcement inspections. The Detective Bureau opened 50 new investigations in the month of August 2024, 22 theft from auto investigations, 5 assist other agencies, 5 theft investigations, 3 child line investigations, 3 firearm investigations, 3 service calls, 2 drug investigations, 2 sexual assault investigations, 1 assault investigation, 1 drowning, 1 fire investigation, 1 hit and run investigation, and 1 outside warrant arrest. The Detective Bureau also executed 14 arrest warrants and 7 search warrants. The following is an overview of Part 1 crime statistics. Burglaries investigated year-to-date are 9 burglaries with 4 clearances. Robberies investigated year-to-date are 3 robberies with 1 clearance. All robberies remain under the investigation by the Detective Bureau. Thefts, including retail theft, year-to-date total 229 with 113 clearances. The Detective Bureau had some notable investigations, included a violation of Uniform Firearms Act and receiving stolen property, a major theft investigation, and thefts from auto with a firearms violation. Our K-9 unit had their monthly in-service training and assisted Horsham Police with a found a burglary and a community presentation for Jefferson Abington Memorial Health Care workers. There were several community-oriented policing activities. In the beginning of August, Detective Gallagher, Sergeant Robb, and Sergeant Cordora spoke to new drivers and their parents regarding safe driving practices. They met with Dr. Baer, the assistant principal at the intermediate school, to discuss an internet safety presentation for back to school night for the parents. Sergeant Lynch's squad escorted a Vietnam veteran from his residence on Warren Street to the VFW for his birthday party. We held a recruitment event on August 23rd in conjunction with the Upper Moreland Fire Department. And Sergeant Cordora and Officer Bald met with staff at the Huntington Valley Christian Academy to go over safety practices and building security recommendations for the beginning of the school year. And that concludes the monthly report for August for the department.
Thank you very much. Any commissioner comments at this time for Chief Ruddle? Any public comments for Chief Ruddle? Okay. Chief, on behalf of the Public Health and Safety Committee, I must say once again, we thank you for your service you provided, filling in the interim months, and you did a great job. Great job. Thank you.
Thank you, Commissioner. I appreciate it.
Yeah, let's do it now. Chief Glassman, Fire Chief.
Thank you, Commissioner. It's my pleasure to present the August 2024 report for the Fire Department. There were 73 fire calls, 24 EMS calls, for a total of 97 for the month. Year-to-date, 830. The fees collected so far year-to-date, 74,329, as compared to 14,500. So we have a positive gain, which means we increased funding by $59,789 so far this year. Significant incidents, I'll show you a couple pictures shortly. On A3, we had a battery fire that was, by the grace of God, not in an attached garage, but in a garage that was separate from the house. We installed 8 smoke detectors. We conducted 3 community events to include 300 people, 27 personnel training hours for 230 hours. We participated in the recruitment event with the police that Chief Ruddle talked about, and our average response time year to date is 3 minutes and 28 seconds. Now, if you can post the slides, I have about 5 or 6 slides of incidents that I thought were significant, some of the things that we're dealing with as first responders, police, fire, and EMS. This was a kitchen fire. That's the bulk of the fire right there. Next slide. This is an interesting property. That's the inside of that house that you just seen. Ladies and gentlemen, that is a hot water heater right there on the left, and you know how big they are. That's the living room into the dining room. That's what your first responders are dealing with out there. And right in the back corner, they got into the kitchen in the back door to the kitchen fire. Thank God it was nothing more than a kitchen fire, and they were able to mitigate it before it extended. Next picture, please. Here's the outside of that house. Obviously, we were working with codes once this occurred, but that's what's going on. Next picture. The battery fire I talked about. This was a garage not attached to the house. We believe the cause to be spontaneous combustion. In other words, they built their own heat. They're filing cabinets that contained lithium-ion batteries out of bicycles that he predominantly bought at yard sales, believe it or not, and he was shipping them in containers to Ukraine. So there's one picture. Next picture. There's the filing cabinets. That's, you know, the day after the fire. Seeing his left hand there, that's the batteries that are stuffed inside all those filing cabinets. Next picture. That's what we ended up having to do with them so that we can ensure that they don't build up heat again. It's a 55-gallon drum, and they were put in the barrel. Next picture. There's Dante, my main man. The volunteers are back. Dante's been on several calls, him and Bud Tucker. So we took a picture on the first day back, so they're back, and there's living proof. Next picture. You know, there's our favorite recruit right there. We had to get that picture. We participated with the police department and their junior camp, and it's just a photo opportunity that we put in there. We're trying to recruit them on the fire department. And that concludes my presentation.
Very good.
I wouldn't want him to find out about that.
Give us a little something.
So also, one more thing. On October 22nd, still a little early, but put it on your calendars. It's a Tuesday night. We're going to do a fire prevention night from 6:30 to 8. Bring the kids. We're going to have an ice cream truck. We got a whole bunch of goodies to give away to the kids and the parents.
Thank you very much.
You got it.
At this time, do we have any commissioner comments from Chief Glassman? Any public comments for Chief Glassman? Okay, thank you very much, Chief. At this time, we'll have the second alarmist report by Chief Ken Davidson, please.
Thank you, Commissioner. In front of you have numbers from July and August. July was 314 calls for service. 67% of those resulted in transport, and as you can see, fluctuated quite a bit throughout the month, and there's a breakdown of the dispositions below. In August, we had 345 calls for service. Again, sort of that same haphazard line breakout throughout the month. 65% of those calls resulted in transport, and the dispositions are broken out below. In the month of August, our details slowed down a little bit. We had 4 details in August, 2 football games in Abington and 2 football games at Upper Moreland, generally both occurring on similar times. And our naloxone administration, we did have 2 cases where EMS gave naloxone in August of 2024. We're certainly continuing to see our share of calls related to substance abuse and mental health disorders increase as time goes on. August staffing, August of 2024, full staffing would be 3,348 hours of ALS staffing. In 2024, we had 3,128 hours of ALS staffing compared to 2023, we had 3,274. Downgrade to BLS staffing 196 hours in 24 as opposed to 30 hours in 23, and downgrade to no status at all 24 hours, which is certainly an improvement from 2023 when we had 44 hours. Our fund drive is out. The reminder should be going out towards the end of September. Actually, I think it'll probably be closer to the beginning of October at this point. So far, the current fund drive, we've received 1,180 memberships from Upper Moreland residents, totaling $76,390, as well as 302 separate donations totaling $10,147, for a total of $86,537 of revenue from Upper Moreland Township residents related to the fund drive and donations. I put some information in here, just wanted to talk briefly tonight about a report that came out from the Ground Ambulance Patient Billing Advisory Commission. That's a lot to say. You've heard me talk several times about balanced billing, about the No Surprises Act, and about the federal commission that was created to see how ambulances would be involved. Initially, ground ambulances and air ambulances were excluded from the No Surprise Balanced Billing Act. Then air ambulances were included. There was still a lot of talk that ground ambulances would be excluded, and then the president released his budget for 2025 that had a piece in there that was going to include ground ambulances. So they did form a federal committee. They met several times. They issued a 162-page document. I provided a link in there in the report that you can get to if you really want to read all 162 pages of it, but they did provide a pretty good summary, and the American Ambulance Association gave a summary. Essentially what they're saying is that we do need to put measures in place to protect patients from predatory practices in billing. Unfortunately, some services do take advantage. Second Alarmers is not one of them. But we do need to have some consumer protection in there for patients to make sure that they're not getting obscene EMS bills, that the insurance companies aren't transferring over a lot of the costs to the patients, and that things are being done properly. So they are advocating that some kind of legislation be formed. They're hoping at the state level first, and then there'll be federal legislation to back that up if the states don't choose to. Currently, 15 states have passed legislation that it involves ground ambulance billing and balance billing prohibitations. And they've highlighted, as you can see in the report that I gave you, several bullet points primarily that there has to be some kind of a fee established or fair payment established. So if they're going to prohibit ambulance services from balance billing patients when the insurance companies don't pay enough, the counter side to that is there's going to have to be something in the regulation that requires the insurance companies to make proper payment and fair payment, most likely based on a fee schedule, most likely based on a factor of Medicare. This would hopefully address the direct payment issue that we've talked about for so many years. In an ideal piece of legislation in Pennsylvania, the insurance companies would be required to pay the ambulance services directly. And again, if they were paying directly and they were paying based on a fee schedule, that would essentially, for lack of better words, eliminate the need to balance bill the patients and provide some consumer protections. There's also some things that need to be factored in. We're unfortunately seeing that a lot of the insurance carriers, especially the managed care Medicares, are increasing the patient's co-payments and deductibles. So we're now seeing patients that previously might have had a $100 deductible or a $100 co-payment for ambulance service, where their insurance companies raised that to $300 or $400 that we're expected to collect from the patient. So we are hopeful that this report from the committee will be the starting point. We're working with our state legislators and hopefully getting them to start to move something forward for Pennsylvania legislation. It would certainly be better if it can start at the state level. And essentially the federal government will likely put something in place as well. So if the state doesn't do anything, there'll be something in the works to protect consumers from balance billing. That's my report. I'm happy to take any questions if you have them.
Thank you, Ken. Any commissioner comments for Ken?
That's just in a committee now? It's not, there's no acts or anything?
Yeah, it's not. So this was a separate commission formed to advise on it. So there's not even really anything in any of the committees. I'm working at the state level. I had the opportunity to go to Minneapolis a couple weeks ago to meet with some of my peers from around the country and learn about the 15 states that do have legislation and some of the things that are going. But we're really sort of at the starting point in Pennsylvania at this point. We have a meeting October 7th with a couple of legislators to hopefully get the ball rolling. But it unfortunately will probably be a slow and tedious process, and we need it to happen quickly.
Have you, or do you know if this has been taken to the Pennsylvania Association of Commissioners or second-class townships?
I believe there was some discussion of it at PSATs and last year, the concept and the balance billing, and this report literally came out last week. So I don't know what's been pushed to them at this point.
We have a meeting in 2 weeks, that's why I said.
Okay. I will definitely see if our folks can get on the agenda there.
Okay. And it would go to PML. They take care of both of those organizations.
Okay. Thanks.
Any other commissioner comments? Do we have any public comments for Ken? No? Okay, thank you. We have no old business and there is no new business. So we stand adjourned. Thank you very much for coming.